Hey everyone, I'm John Lind, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Maynd Jolly. He's CFO at enGen, and Mike Stimpson, CTO at enGen. Welcome, guys.
Thank you. Thanks for having us.
Yeah.
Glad to be here.
Excited for this discussion. You guys got some really interesting things you're working on at enGen, but Mike, why don't you kick us off? Tell us a little bit about yourself and enGen.
Yeah, so enGen is a health tech company headquartered in Pittsburgh, Pennsylvania. We're actually a wholly owned subsidiary of Highmark Health. So we very much operate in kind of the owner-operator model. We provide services and application suites for both payers and providers. So we have about 20 million lives on the platform. And glad to be here with you.
Awesome. Maynd, how about yourself?
Glad to be here. So 20 years in the industry, have been part of MedTech with GE, Siemens, and many others. Have a strong background in corporate finance and finance and accounting and investments and M&A. So happy to be here with enGen. I'm just new, just 4 to 5 months old in the company. So really learning the ropes and enjoying the role.
Well, welcome to the fun, I guess. Well, you've been in healthcare for a while, but Mike, tell us, here at Health, we're hearing all sorts about AI, but talk to me about how is enGen implementing AI responsibly, not just implementing it, right? Talk to us about that.
Yeah, no, it's a great question. And yeah, AI is everywhere here today. A lot of what we're doing is, when we look at it responsibly, is making sure that we're putting the human as the last person in the decision chain. So we never want to deny any care to any members. So we're utilizing AI to help inform our team on how they respond to questions that come in, how they process our claims, in the insurance business, and other kind of decisions around kind of appropriate care.
Interesting. Do you have some examples of AI-driven innovation that you see, including maybe things like predictive AI, and maybe talk about some of the impact of those examples?
Yeah. So one of the things we try to do is get to the answer, kind of get to yes quickly. So one of the things we're doing is we get 240 million claims through our systems every year. So lots of claims. Many of them, almost 90-something% of them, we actually process straight through electronically. Others have to be reviewed by a human. So what we've started to do is use predictive models in our AI platform to make predictions that can be presented to the claims processor that tells them, hey, should I approve this, or does it need further review? So it's getting them the answer and the information more quickly, giving them a probability of what the response should be so they can respond more quickly.
Interesting. I bet the processors love that, right?
It does. It makes it, sometimes we say we want to take all the boring, mundane stuff you have to do in a day, and let's automate that first, and let's focus on kind of the more interesting things.
Yeah. Maynd, what would you add to this, as far as some of the other cost trends in the healthcare industry? Obviously as CFO, costs really matter, and also, how is AI impacting the costs that are associated with it, as we implement these solutions?
Absolutely. So I think we have a unique vantage point. We have a provider and we have a payer system, but from a technology standpoint, as Mike is saying, the moment we use such as AI Claims Examiner, I can reduce the cost of processing a claim, which directly impacts cost of the payer. So I can reduce my PMPM to my customer. But at the same time, I make sure the patient gets the right care, at the right time, and provider get the right reimbursement. So there's a revenue impact to the provider, and there's a massive impact on the cost side. So our job as a technology company to ensure, can we provide faster, better, cheaper solutions using AI and really reduce the cost for the payers, but for the providers, can they get more revenue? And can they provide the right care to the right patient?
I was going to say, that one seems like the bigger impact almost to me. Sure, you save costs in processing the claim, but now the claim is processed faster, the providers are happier, you get you get more provider commitment, et cetera, right?
Yep, absolutely. On top of that, I think what we see is that once you do that, the patient experience is better. So are you providing them a better opportunity to understand their own benefits? Can they see, oh, my insurance is working, I pay for it, my employers pay for it, and I get the right benefits out of it. So the end impact for doing all this is extremely high for the patients.
Wow, I love that you brought in the patient. Ironically, I just got a bill from something that happened 13 months ago. It's the first I saw of any claim, any bill, anything. It's insane, right? but this is what happens. It gets delayed. I'm worrying about the bill. So I love the patient perspective. When you look at profitability, which is an important thing, right? No profit, no mission, right? Like that's what happens in healthcare. What would you say the role of improving healthcare outcomes is in profitability?
Right. So I think we take multiple angles to it. One angle is, if I improve profitability of a payer, how do I do it? Like by risk adjustments, by HEDIS, by star ratings. So that just improves their accessibility to more money, to value-based care. But at the same time, if I do the same thing for a provider, can they get a better, I would say, a healthcare solution, whether it's a surgery, whether it's a medicine, whether it's something else, whether it's a therapy, in a faster way, then it just reduces the friction for the patient, right? So all in all, if we do our job right from a technology standpoint, everybody gets the benefit.
Yeah, I love that. It's always great when there's a win-win for provider, patient, and payer, but it probably helps that you're a provider and you care about all of those aspects. That's interesting. Mike, how about from a tech perspective, how do you make sure that the right care is being given at the right place at the right time, and how do you proactively facilitate that rather than, I would define our healthcare system has always been very reactive. Talk to us about that kind of shift of mindset.
Yeah, absolutely. And you hit it already when you said, you got a bill 13 months after. In the old day, kind of in the past, it could take you months to get data about patients. Now we work with our hospital systems and our other partners to get as much data as quickly as possible about members. So it's all about knowing everything about the member. So whether it's their clinical data from their recent hospital visits, that allows us to make decisions on what's best for them. We want to understand how they want to be communicated to. Do they want a text message after work? Do they want the old-fashioned, paper explanation of benefits? So we really try to collect as much information about the member that we can, both from clinical sources as well as the information we collect about their preferences, and bring that together. Then we use that data in what we call our member listening system, which is really all about taking all of the information from the clinical systems and trying to predict what potential conditions that may occur to them so that we can help get them to the right care programs.
Interesting. And it's interesting, enGen obviously works with Highmark, a subsidiary of Highmark. Is this available for other payers, providers? How are you approaching it from a market perspective? Who can get access to the data that you're talking about?
Absolutely. So we provide a number of services. The largest one is really almost a health plan in the box. So we have our platforms run across the entire payer value chain. So we have other health plans using all of our systems. Sometimes they also utilize us for kind of business process services, but sometimes it's more of a software as a service model. We also have point solutions like our Predictive care management platform, which is really focused on and improving prior authorizations. I'm sure you haven't made it this far yet today, talking about prior authorizations with people. So we utilize our Predictive system, and its authorization automation hub is one of the key solutions right now that we're having a lot of conversations about.
Interesting. And it really is a team sport, right? Like healthcare, sure, you have a lot of data. Highmark has a lot of data to be able to do stuff, but you don't have all the data. And no one ever will, as much as Epic wants to. But anyway, we're going to have a disparate system, right? That's just the reality. So how do you approach partnerships and kind of making the solution work for your customers?
Yeah, do you want to grab that one?
Yeah, definitely. Well, from a partnership standpoint, you hit it right. We can't build everything, we can't buy everything, we need to partner for something. So, for example, we're a great partner with Google Cloud, right? And all the AI and member listening systems, all the things are built on Google technology. But at the same time, we are a great partner with Epic as well. How do we use their payer platform and bring better apps to the providers? And at the same time, we are also partnered with multiple startups. So we want to make sure the best technology comes on our platform and it's accessible by everyone, by providers, by payers. And I would also mention, as in you said, is it available for other providers and payers? So I'll say yes. We are game for meeting anyone and helping them out in their own journey and achieving their strategy. Yep.
Yeah. Well, I love that you're enabling startups because I think it's hard for startups to get in, right? And to get all the data that you have and the understanding of the industry. So that's powerful. Well, Maya and Mike, I appreciate you taking time to sit down with us and share about this interesting approach to AI, to data, and leveraging it for both the payer and providers. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, guys.
Thank you.
Thank you.